How do adenocarcinoma subtypes impact prognosis? Imagine a puzzle where each piece tells a different story about how lung cancer might behave. That's what the different subtypes of adenocarcinoma do. They help doctors understand how aggressive the cancer is and what the chances are for recovery. Adenocarcinoma is the most common type of lung cancer, and it can be divided into several subtypes based on how the cancer cells grow under a microscope. These include lepidic, acinar, papillary, micropapillary, and solid types. Each of these has its own story to tell about how the disease might progress. The lepidic subtype is often seen as the least aggressive. It tends to grow slowly and is usually found early because it doesn't cause many symptoms at first. Because of this, patients with lepidic adenocarcinoma generally have a better outlook. On the other hand, the acinar and papillary subtypes are considered to have an intermediate prognosis. They are more aggressive than lepidic but not as dangerous as the micropapillary or solid types. These tend to grow faster and have a higher chance of spreading, but they can still be treated effectively if caught early. The micropapillary and solid subtypes are linked to worse outcomes. These are often poorly differentiated, meaning the cancer cells look less like normal lung cells. This makes them more likely to grow quickly and spread to other parts of the body, including the brain. Patients with these subtypes often face a higher risk of early metastasis and tend to have lower survival rates. The degree of differentiation is a key factor. Well-differentiated tumors tend to grow more slowly and have better survival chances, while poorly differentiated tumors are more aggressive and harder to treat. But subtype isn't the only thing that influences prognosis. The stage of the cancer at diagnosis, the size and location of the tumor, whether it has spread to other parts of the body, and specific genetic mutations like EGFR or KRAS all play a role. Early-stage adenocarcinomas, regardless of subtype, have much better survival rates, sometimes up to 85% over 5 years. In contrast, advanced cancers with distant spread often have survival rates below 15%. Knowing the subtype helps doctors decide on the best treatment plan and how closely to monitor the patient. For example, someone with a micropapillary or solid subtype might need more aggressive treatments and frequent checkups because of the higher chance of recurrence. Meanwhile, a person with a lepidic subtype might have less intensive treatment and a more optimistic outlook. In summary, the different subtypes of adenocarcinoma influence how aggressive the cancer is and how likely it is to spread. Recognizing these subtypes allows for more personalized care and helps patients understand what to expect. If you or someone you know is dealing with lung cancer, it's essential to work closely with healthcare professionals who can interpret these details and tailor the treatment accordingly. Always remember, individual cases vary, and medical advice from a qualified doctor is the best way to get accurate information about prognosis and treatment options.